10 months, we have been arguing or watching an argument about government-run health care. And we have been watching an argument about the level of spending that Congress feels is adequate to get our country moving again in the right direction. And I can't tell you how more firmly in disagreement I am with the policies that are being put forth by our member of Congress and this Congress. First and foremost, I am vehemently opposed to government-run health care. I think New Hampshire has spoken. I think the American public has spoken. And it's about time that we have a representative that listens to the kinds of reforms that people are looking for. I think most people agree that the quality of care in this country is the best. And I think what people are looking for are solution-based ideas, not partisan ideas, but solution-based ideas to make insurance more accessible and more affordable for everyone in this country. And that is a big, big difference between proposing a government-run plan or what I and other members of Congress have already proposed. And the first thing I want to do before I continue on with the town hall is to make a commitment to each and every one of you so you know clearly where I stand. If this bill passes, the first thing I will do is fight to repeal it, and I'm going to sign a pledge right now to make sure that everybody knows that I'm clearly on record as to how I would represent you. And this is after 10 months of campaigning, listening to people, holding town hall meetings, and hearing that people don't want government-run health care, but they want real reform that's going to positively impact you, your family, and your business. For those of you who haven't seen this, I just want to quickly read it so everybody knows what I'm signing. It says, "Repeal it, U.S. Representative Candidate Pledge." And it reads, "I, Frank Guinta, hereby pledge to the people of my district, New Hampshire 1, upon my election to the U.S. House of Representatives, to sponsor and support legislation to repeal any federal health care takeover passed in 2010, and replace it with real reforms that lower health care costs without growing government." And I think that this is an important pledge because it says three things. It says government is not going to run your health care. It says I'm not going to spend more of your money to provide you more health care. And it gives you a promise, a point-blank, direct promise that if I ever violate it, you have every right to fire me as your member of Congress.
Is for the government to allow the over 1,300 companies to do business in all 50 states. Competition will drive the price of our best in the world already health care. But Barack Hussein Obama voted against this when he was in the Senate to allow the over 1,300 companies to do business in all 50 states. People aren't talking about this, but if you really want to lower the price, you said solution-based idea, here it is, the best one I've ever heard. Allow the over 1,300 companies to do business in the 50 states. Look at what the competition does in every other arena. It drives the price down. Thank you very much. I'd like to hear
Sure.
if you'll introduce a bill to, and of course we know the libs are going to vote against it.
Well, how you buy car insurance is how we should be able to access health insurance. You are not restricted when you buy car insurance to just companies that do business in New Hampshire. You can actually go on websites. You see commercials on TV that there are transparent websites that show you different prices from different companies. I believe that you should have that ability to buy whether you live in New Hampshire or the company is located in Massachusetts or Iowa for that matter. And you're absolutely right, that would reduce cost immediately because the competition and a market-driven solution, I think, is the answer. Now, the response that I get is, well, we're a network-based system. We are a network-based system. And guess what? If you allow other companies from other parts of the country to do business here, they will create networks that are just as strong and just as competitive as the ones that exist today. And you will see immediately costs come down. We are looking at a massive change. It's a one-size-fits-all approach. We have about 45 million people who are uninsured in our country. We have about 12 million who truly can't access it because of affordability issues. That's the problem. The other problem is the affordability for the rest of us. So there are two major issues that I think we should be focusing on. And market-driven solutions and competitive approach, I think, will bring both of those into line. Now, if you're a small business owner in New Hampshire, here's one thing that I hear from small business owners all the time. Right now, if you have less than 100 employees, you are considered a small business. And you cannot compete with a company that has more than 100 employees. So your cost for the same coverage is different. There is no reason that you should not be able to pool your resources together, if you're a small business, to exceed that 100 employee limit, and thereby reducing your health insurance costs by as much as 20% immediately. That's not being done. It should be done, and that would help New Hampshire, which is a small business state. 95% of our business is small business.
A question about philosophy, but hopefully the soon-to-be ex-Senator Harry Reid made a big deal about how he was declaring health care no longer to be a privilege, but to be a right. And I got very ill. So I'm interested in hearing your thoughts on that philosophy.
Well, it's not outlined as a right in the Constitution, and one of the things that I think we ought to do more of, and if you ever have watched a Board of Mayor and Alderman meeting, you would regularly see me with a little red book. Most people don't know what that is. That's the city charter. When I was a legislator here in New Hampshire, it was fairly regular, a normal thing to see legislators with the state constitution. And why we shouldn't be talking about the Constitution is beyond me. It is the book that guides our country. And as an alderman, I tell people this. I try to relate it to what I've done as a mayor. I have the book at every meeting to decide if we are focusing as a government on what we're supposed to be according to the city charter. There's no reason we shouldn't be doing the same thing with the Constitution. Now, I'd like to make sure that people have affordable access to health care. But there are things that we can do without law and regulation to foster an environment where your access is immediate, affordable, and the best in the world. We already have the best health care in the world. And I don't think that's debatable. I think most people, regardless of party affiliation, agree with that. But I consistently hear from members of both parties that affordability is an issue, whether you're an individual or a business owner, or whether you just can't access it. So that's something that I think we can address. But I don't believe that it should be mandated by the federal government. And I would not, and that's why I signed this pledge, because it's serious to me. I'm not going to mandate it. I don't believe that that's the appropriate way to provide you health care.